What's going on, everyone? Welcome back to my channel. In today's video, we're going to be looking at 3 exercises for proximal biceps tendon pain. So if you've got pain up here on the front of your shoulder, then these will be exercises for you to implement. So again, the bicep tendon runs up on the front side of the shoulder. We have 2 bicep tendons, the short head and the long head. The long head actually goes up inside our shoulder joint underneath this bone, which is part of our shoulder blade called the acromion. So in that space under the acromion is our bicep long head tendon, one of our rotator cuff tendons, the tendon for our supraspinatus muscle, and a bursa. So people can have bursitis there, tendinopathy of either of these tendons. So it's a very common place to have pain. So again, if you have pain on the front side of your shoulder, it could be your biceps tendon. You can actually kind of go side to side and you can feel your bicep tendon. It's sort of a ropey structure. If you feel that tendon and it reproduces your pain, then again, this could be the condition that you are experiencing. So we're going to look at 3 exercises that load the tendon. They help reduce pain and improve strength of the tendon. So for the first exercise, we are going to perform a supinated bicep curl. Our bicep muscle, of course, is mostly an elbow flexor. It helps to bend our elbow, but it does also assist with shoulder flexion. When the pain is up towards the proximal end near the shoulder joint, when symptoms are acute, it can be helpful to strengthen the elbow action of the bicep muscle initially. Even though it doesn't target the top side a whole lot, it will apply tension through the whole muscle and all of the tendons and can again help reduce sensitivity in the acute stages. So find a dumbbell that's challenging for you but doesn't create more than mild pain. If you have an exercise bench, it can be really useful in terms of putting it into an incline setting like this and then performing a preacher curl. So I'm going to kind of squat down, put my humerus, the upper part of my arm, on the bench, and then I'm going to do nice, slow bicep curls with my palm facing forward, so in that supinated position, which is going to be a little bit better in terms of targeting the biceps brachii muscle and again putting tension through its tendons. I will also work some of the other muscles, brachialis, which is down below the biceps brachii, and a little bit potentially of brachioradialis, but this supinated position will allow us to be a little bit more specific about biceps brachii and those tendons up in the shoulder region, as well as the tendon down below towards the elbow. So think about going for 3 sets of 10 to 15 repetitions. And again, pick a weight that's challenging but doesn't create more than mild discomfort. And I would try to perform this every day or every other day if your symptoms flare up. If for some reason you don't have a bench, you can just stand and just do a normal supinated bicep curl. You don't have to have the bench, but it is a nice way for sort of isolating the movement. For the next exercise, we're going to use a loop band and we're going to perform resisted supination. Biceps brachii, besides flexing our elbow and flexing our shoulder, it's also a powerful supinator. So it rotates our forearm over so that our palm is facing up. So we want to strengthen that action as well. So what I'm going to do here is grab my loop band, apply, kind of wrap up on it so you can get a little tension on the band. You're going to pull with the other arm to create some tension. And then what I'm going to do here is start with my forearm in neutral with my thumb facing up. And then I'm going to pull with this arm, again to create tension, and rotate over into supination. So find the band that's challenging for you. You want this to be hard to perform. But again, when we're thinking about tendon rehab, we don't want to have more than mild to moderate pain. So that rotation is going to strengthen my supinator muscle in my forearm, but it's also really going to target my biceps brachii muscle. I can actually feel this, a decent kind of level of fatigue and burn in my left biceps right now. So again, think about, with a strengthening exercise, think about 3 sets, 10 to 15 reps. See if you can perform it every day. If things are really tired or your pain's stirred up a little bit, then you can switch to every other day. Okay, so that is our banded supination exercise. For our last exercise, now we're going to be really specific in targeting the shoulder flexion action of the biceps long head tendon. So you're going to again pick a dumbbell that's challenging but doesn't create more than mild pain, and we're going to perform an uppercut action. This will work that shoulder flexion action of the biceps brachii long head tendon, so we can again reduce sensitivity and improve capacity of that tendon. So you're going to hold your dumbbell, rotate your palm forward in that supinated position, and then come up sort of like you're punching at about chin height so that your shoulder gets to about 90 degrees and your upper arm is parallel to the ground. rotate back down so your palm starts facing your side, and then as you come up, supinate, rotate, and up. And you're gonna think about performing 3 sets again of around 10 to 15 repetitions, going until you hit a point of fatigue. If you feel a little bit of discomfort in the tendon, that's okay, as long as it resolves by the next day, basically, is what we look at. So within 24 hours, you want to be back to baseline symptoms. If you're not, then you probably need to drop the weight a little bit, or maybe do less sets or less reps. So you just have to experiment with it a little bit until you figure out the right dosage for your current situation. Thanks for checking out today's video. I hope you find these exercises to be helpful. In the shoulder chapter in my book, on page 224, you'll find a more comprehensive biceps tendinopathy program. This program, like all the programs in my book, will guide you through 3 phases of rehab and have pictures of me doing all the exercises. It's all the programs in the book are more comprehensive, basically like if you came to see me in the clinic. Each body region has its own chapter. So if you'd like a resource like this that allows you to do your own physical therapy at home, I will put an Amazon link for the book down in the description. Thanks again for checking out today's video. I'll see you in the next one. Bye.